Okay, so as I mentioned in my last video, Millie has been hospitalized for kidney stones. We've been here since January 8th, and so I thought since I haven't posted a video in a while that I would do a video about cardiac kids and kidney stones. It's very rare, but it is something that happens, and of course we would be the family that it would happen to. So many cardiac children are treated with something called Lasix or furosemide. This drug is used to help take fluid buildup from around the heart and flush it out of the body. Cardiac babies often retain fluid, and they can be on this drug over long periods of time. Fluid buildup around the heart can make their little hearts work harder, which is not what we want. In very, very rare situations, this drug, because it leaves calcium behind in the kidneys, can cause kidney stones, or renal calculi. We found this out last summer when Millie, after being on furosemide since birth, developed kidney stones. Signs and symptoms of kidney stones in babies include pain, with back arching, grunts, uncomfortable and difficulty settling, blood in urine, so pink diapers, vomiting, and difficulty peeing. I have lots of fun facts about kidney stones, so I'm going to stick them into this video. So first fact, kidney stones do not hurt once they reach the bladder. The part that hurts the most is when they pass from the kidney to the bladder through the ureter.
Fun fact, kids' ureters can stretch in order to pass stones as large or larger than adults can.
Millie had 4 stones. She passed one over the summer, and we are currently in the process of passing 2 more. Next fact, if kidney stones block the ureter, they can cause toxins to back up in the kidneys, creating a severe infection or sepsis. Next fact we just learned, one of the ways they can tell if a stone is blocking the ureter or if there is sepsis is if the kidney and area where it flows into the ureter are swollen. Millie had a temperature of 39.8 the other morning and was in extreme pain. So what did they do about it? Not much. If the child has a continuous high fever or is unable to urinate, they will do surgical intervention. Next fact, they cannot do shockwave lithotripsy treatment to break up stones in children. Next fun fact we learned, babies are very difficult to do interventions because they are so small. Millie currently has 2 stones in her ureter. Both are under 2 millimeters, so they are hopeful they will pass on their own. Next fact we've learned, it can take up to 10 days to pass a kidney stone. So we are currently waiting to see if Millie's stones will pass on their own or if we need surgical intervention. Because Millie is a complicated cardiac baby, they don't want to do surgery unless it's necessary. If they do surgical intervention, there are 2 options. The first is to place a stent through her back into her kidney to drain infection. The second is to place a stent through her bladder at the end of her ureter to help the stones and infection pass. Last fun fact we just learned, kidney stones can cause urinary tract infections, so Millie is currently being treated for that as well. Because infection can spread really quickly and make these kids very sick, we have to stay in hospital and be monitored by urology until the stones have passed. It's starting to feel like we may never get home. Mom and Dad are starting to think it would be easier if we just lived in Toronto.